As part of your discharge instructions, you are instructed to follow up with me in about a month. The idea here is to see you at an appropriate time, and although a month may sound a long time to you, from experience I can tell you it's about right. We will do multiple different things at that appointment. First off, I'm going to check your wound to make sure that it looks good and that there's no risks of infection. Secondly, I'm going to check your function very carefully to see how your strength is and whether or not your numbness has gone away. I use this data and this information to help determine how fast I can get you back to work and whether or not to start physical therapy. If you have any true weakness, I will be recommending formal physical therapy to help you regain your function. If you're extremely stiff in your low back, same thing. We'll try physical therapy to help out. Another important aspect of this follow-up appointment is getting back to work. Generally speaking, after low back surgery, people don't go back to work until this evaluation. I will look at what your job is, and I'll discuss with your employer and your agency what job opportunities there might be for you, and I will try and determine what is safe for you to go back and do. Everyone wants to go back to work, and I want you to go back to work too, but just in the most safe environment as possible. When you come back to the clinic, again, there will be some forms for you to fill out. These are very important as part of the NCQA evaluation. Commonly at the 1-month follow-up, your insurance company is asking for an update, and so I'll send letters to them and tell them how you're doing and what to expect in the future. Assuming that things are going well and your leg pain is very much diminished, if not absent, and assuming that your function is coming back, we don't need any more x-rays. Commonly, no further films are required. In the future, if you have a return of really bad back pain or a return of numbness, tingling, or weakness down your leg, I want to know about it, and we'll consider a new MRI scan or plain x-rays at that time, depending what your signs and symptoms are. I very much enjoy the 1-month follow-up appointment. Patients are usually very happy. Their pain down their leg is usually gone. Their function is commonly returning, and sometimes it's completely resolved. We're working towards positive things like going back to work and resuming their normal activities of daily living. They're usually pumped up and energized by all this, and we all are. If all is going well, I will want to see you back in 2 more months, meaning 3 months from surgery. That is a final check to make sure that all is well and that we've covered all the bases. At that appointment, we'll make sure that all of your final paperwork is completed. Hopefully you're back to full duty at work, and if you're not, we'll continue to see you, of course, until you are. There's no rule that we're going to cut things off at 3 months, but generally speaking, that's about right. I hope that this will be your outcome, and if it's not, we'll deal with all the issues at that time.